turn to obesity. The AMA is committed to help reducing it. Ron Davis was, in fact, of great importance in being sure when the AMA Board of Trustees was in town, they ate healthy foods, oatmeal, vegetables, lettuce, lean chicken, fish. Lunches changed very acutely at the AMA headquarters, thanks to Ron Davis's efforts on our behalf. Other ways that the AMA is helping: the AMA Healthier Life Steps Toolkit, a physician primer on helping your patient lose weight. You know, I always have a problem, though, when the patient's doctor weighs 3 times more than the doctor is supposed to weigh, trying to tell a patient to lose weight. So we must lead by example. We are also in support and have been involved in Michelle Obama's Let's Move campaign against childhood obesity. And our AMA Foundation currently is taking on a joint effort with the AMA itself in an anti-obesity program addressing family issues that result in obesity. When a parent is obese, a child is obese. So we must address this at a significant level. Immunizations. The AMA continues to work to inform the public about immunizations, especially those given in childhood. We've also helped with H1N1 vaccination strategies, and the AMA actually developed a microsite that was used to communicate up-to-date information to both physicians and patients regarding immunization status, why you want to do it, and so forth and so on. There were almost 1 million patients attracted to that website during the activity around H1N1. And the AMA was also involved in establishing and working towards the CPT code for the H1N1 vaccination, so the patients could get the vaccination and the physicians could be compensated appropriately for administering the vaccination. Disaster preparedness, another area of high-intensity work for the American Medical Association. The Center for Public Health Preparedness and Disaster Response is the AMA's conduit for educating physicians and others on effective response to earthquakes, floods, acts of terrorism, and other emergencies. And this really came out of Katrina. About the time Katrina occurred, really maybe 6 months before then, the AMA had already started moving in that direction. Well, Katrina simply pushed the envelope very quickly and enabled us to move on in a very rapid way in our Center for Public Health Preparedness and Disaster Response. Out of that came the Disaster Medicine and Public Health Preparedness, which is a global journal, and its March issue, interestingly enough, on earthquake survival intervals had been instructive to those working in Japan. I will tell you that at the time the earthquake occurred in Japan, on the ground in Hawaii, where several of our AMA senior staff, including Dr. Jim James, who heads up this group, on the ground in Hawaii doing some other things for Hawaii surrounding disaster preparedness. When, in fact, the tsunami occurred, the AMA folk on the island of Oahu were actually then in touch with the folk in Japan, and out of that came significant information and help. It was interesting that the journal contained in it, the one that just came out on nuclear problems and nuclear potential radiation exposure. So all of this was very timely in relationship what was happening in Hawaii potentially, and then obviously in Japan. Very, very devastating issues there. The AMA helped form the National Disaster Life Support Education Training Program to help standardize emergency response training nationwide, and this is something that's probably going to be taken worldwide as well as we work with the World Medical Association on this, using what we learned. You know, the thing about doctors, when disasters occur, their hearts are so open and they want to go help. And you can't help if you don't know what to do or how to do it. And you've got to be able to do the right job at the right time, at the right place, in the right way. And what this training program does is enables physicians and other healthcare workers to be trained appropriately, so when they do show up, they know how to do what is necessary. And in an effort to put at least one aspect of public health squarely in the public's hands, the AMA introduced Citizen Ready, to help spur citizens to respond appropriately in the event of the flu pandemic. And interestingly, we learned that, as you all already knew, that most of this is local anyhow. You have to do it at the local level to get it right. And it was citizen ready that enabled consumers on the ground to be prepared to handle issues surrounding influenza. And this is a format that's adaptable to other disasters or potential disasters as well. Let's talk a little bit about Kentucky. I grew up here, so I'm kind of an anomaly because I'm one of the few actively practicing physicians in the city that actually grew up here. Most of them have been imported, and I'm kind of fond of the place. Kentucky stands quite tall in the arena of public health and evidence-based practice. Kentucky is proud to have the Center for Public Health Services Management and Research, founded by our own Dr. Doug Scutchfield, whom we fondly refer to as Scutch, in case you didn't already know that. Through research grants, conferences, and other methods, the center seeks to explore the impact of public health strategies on the quality and performance of public health. Also key has been the Robert Wood Johnson Foundation. It has partnered with the University of Kentucky to launch a mini-grant program offering research awards to fund dissertation research and pilot studies by junior researchers. It has made funding available for public health research studies involving practice-based research networks, public health policy and law, and quality improvement research. The foundation's support is also enabling the University of Kentucky to harmonize. I didn't know what that word meant until about a year ago, until someone really explained what it meant, and I'll get to that in just a minute. But to harmonize research data on organization, staffing, financing, and service delivery in the public health system. And additionally, the University of Kentucky has worked with the National Library of Medicine to develop a searchable database of publicly available data sources to help public health researchers.